So what I'm going to do now is introduce you to the person who is my boss, Ken Samet, our next speaker on the program. And this is actually a real treat for me because I've known Ken since 1995 when he and Joy Drass recruited me to the Washington Hospital Center. Now, the rule of bosses says never consciously do anything that's going to embarrass your boss. Well, I am about to knowingly violate that rule. That is correct. May the spirits forgive me. As I said, Ken and I have known each other for essentially 20 years. And so what I'm going to say is based on the benefits of both direct observation and the extensive time we spent together. The bottom line is that we at MedStar are extremely, incredibly fortunate to have Ken as our leader. You know, like any organization, MedStar does some things okay, many things extremely well, and there's several domains in which we qualify as being truly exceptional, even really actually on a nationwide scale. And I'd say put the Curtis National Hand Center at MedStar Union Memorial Hospital in that exceptional category, the National Center for Human Factors that we have at MedStar, the Medical House Call program for the frail elder at MedStar Washington Hospital Center. Those are national level exceptional programs. And there are others. And one of those others in that category of MedStar Exceptional, which I'll call it, is the person who sits in our CEO position, Ken Samet. What I do know for certain is that we would not be gathered here were it not for Ken, because back in 2009, it was Ken who had the wisdom and the boldness to charter the MedStar Institute for Innovation. And humble enough to say, and I quote him, "If I already know what MI2 is going to be, it wouldn't be very innovative." And why do I say humble? It's really two reasons. First of all, the statement reflects a recognition that the world is changing fast and that it's virtually impossible to predict the future. And secondly, it reflects a recognition that he himself does not have all the answers. No one does, and that our organization will be stronger if it has people who see the world differently and we all work together. Another thing I do know is that about Ken is that he believes deeply in one of the core foundational premises of MI2, which is that there is a huge amount of creative and intellectual capital at MedStar. So I want to just close by highlighting one quality of Ken, one that I know also from direct experience. Ken is, and I'm going to use a Yiddish word here, a total mensch, a genuinely good and decent person, a person of great integrity, honor, and authenticity. Connecting with everyone he encounters, from the board president to the line nurse, the environmental service worker, and I've walked the halls of Washington Hospital Center with him where an environmental service worker recognizes Ken and he, the environmental service worker, from 20 years prior when Ken was president at the Washington Hospital Center. So I know Ken is getting increasingly uncomfortable with all these well-deserved accolades, so I'm going to stop here and ask all of you to let's give it up for Ken Samet, our leader, President, and Chief Executive Officer of MedStar Health.
Well, Mark, that was very nice. Good morning. It's nice to see everybody. I'm only upset for a couple of reasons. Mrs. Samet, where's Mrs. Torrey? Hi, Mrs. Torrey. I'm only upset that Mrs. Samet, my mother, is not sitting next to Mrs. Torrey. So she could have heard that, because for those that have heard me before know, my mother still thinks I can get into medical school before this is all over with. So there's a whole different presence. It's the smell of whatever, Ed, I don't know. So it's about memory. So, but just a couple of comments. So Dr. Smith, I trust him, cutting edge. He's going to lead us into the future. Yet clearly he just shared with us, he is stuck in the past. His music is better. No, it's because his music is better. It's not because he's stuck in the past. You know, my father, God bless him, he's 83 years old. He says his music's better than our music. So I don't know, Mark, we're going to work on that piece. Mrs. Torrey, this is your moment. This is about memory, right? Organizational memory. You have the memories for Ed. Anything you want to share today, this is Ed's nightmare moment. Any memory, you're smelling the crabs, the pasta, what comes out? I'll take you off the hook, but we do want to tell you, he's a terrific addition to MedStar. He's helping lead the way, and I hope you're very proud of him. And he didn't get here except for you. Also want to recognize someone who has terrific organizational memory, both for MI2 and for MedStar. Really a treat for me to see a dear friend, a colleague for all of us who came back to visit, Dr. Bill Thomas, the founding chief medical officer for MedStar. Bill, stand up. So organizational memory is a funny thing when I look at Bill, right? Because organizational memory also comes back strongly. My presence, right? The crabs and the pasta come back from seeing Bill. It brings back lots of memories relative to what we were all about, what we were trying to build, what we were thinking when MI2 came about, and long before that. So people like Bill and others that you all know whose shoulders you're standing on, they keep us honest. They keep us grounded relative to what we're trying to do going forward, what we're protecting, and what we're trying to do. So you'll hear lots of comments from me, some different twists around organizational memory. I do want to note, though, that I guess it's fitting. Mark gave me 11 minutes on the agenda. 11 minutes. As those that know me, I can't do hello in 11 minutes. 11 minutes. So I tried to think, why did he give me 11 minutes? Because I think that 11, actually the digit 1, is somehow very important to Mark. Because my organizational memory says that the first major announcement and partnership that the MI2 put in place was the Cleveland Clinic Innovation Alliance on 1/11/11 at 11. That would be January 11th, 2011 at 11.
11/11.
11/11. Mark purposely picked it. I don't think it's coincidental then that somehow he's wrapped me inside an 11-minute talk. I just don't yet know where it's going, but that's the beauty of MI2. I never exactly know where MI2 is going. So I'm really proud to be with you all. This is personal for me, as Mark said. After maybe about a year and a half after moving into and having the privilege to serve as your president and CEO, I put a new organization structure in place, and it had all of whatever the best thinking from so many folks could have, eureka moments, as Ed calls them, relative to what I thought we could do as we thought about the future of healthcare. But it was really important, and the statement that got made was an oval on an otherwise traditional square structured org chart that you all are so familiar with. We had an oval coming out of the office of the CEO, and it said MedStar Institute for Innovation, and that's how we created it. The oval was purposeful. It got so much attention. It's incredible how, for the most part, myself included, we live in our own boxes. We live in the structure we're comfortable with. That's a part of that organizational memory that we're grounded in. The oval upset so many people. What is that? Why is that? Why is that different? Can we have an oval? Why do they just get an oval? You cannot imagine the conversations. We never got to substance yet. We're just talking how it looked on the chart. But actually, it was purposeful, and it started to create that exact dialogue. What I wanted was a place for MedStar's greatest strength, our people, all of you and those that you represent that aren't here, that are doing important work across our region on behalf of our communities. I wanted a place where our people would have a safe and protected and engaging place, a place that would encourage them to think differently, to be creative, to think about how we could provide care differently, how we could improve on our quality and safety journey, how we could utilize this special place combined with the important work that we do to actually recruit and retain the best and brightest. It was a place to embrace innovation, to advance health. And I'm really pleased that all of that clearly is coming together as I look back through my organizational memory since we created it. To give some context to a line that Mark used this morning, proving that we didn't actually rehearse our comments, the board actually, when the organization structure rolled out, and I shared it with the board, the question that they asked was, so tell me, Ken, what do you think about this MedStar Institute for Innovation? What's it actually going to do for MedStar? And of course, they were asking from the classic question of how many resources, what's the return on investment? Tell me something concrete. And my answer was exactly as Mark said. If I knew what MI2 was going to do, it wouldn't be very innovative. And I would encourage you all inside of that. It was not a comment that I prepared for because it was a question that I'm not sure I saw the board asking. But it came right from the gut. It was exactly what I think. And I think the power in that answer is something for all of you as you're working with those that look to you for leadership. We don't have to have all the answers. What we have to do is be willing to encourage our folks who have great talent and knowledge and energy to come together and to help us think through what that future answer is going to be. The timing was actually great for the creation of MI2 because, as you all know, healthcare, like so much of our world, is undergoing incredible transformation. innovation, information, big data with big computing now that actually lets it become actionable. Technology that's changing how and where care gets provided. It is incredibly revolutionary, and it is absolutely disruptive. And if you think it's disruptive today, I promise you, when we're having this talk 3 years from now, you'll think today is really the good old days. The level of disruption that's coming from non-traditional competitors, forcing us to think differently. We used to do strategic plans. We'd talk about other hospitals or hospital systems. I respect them all. As good and worthy competitors, we're all trying to do important work. But the competitors of the future, the non-traditional competitors, Walmart came out 2 weeks ago and said they will be the #1 healthcare provider in America when they're done with their strategy. Forget whether you believe it or not. This is a $400 billion organization staking a claim in our backyard. Google and Apple. We shared with the board actually at MedStar September board meeting a very interesting blog article when Apple came out with all of their latest announcements, and the watch is not about the watch. It's not about everything you know about Apple. They think they're going to actually control healthcare through the data and the connectivity that comes behind that. These are absolutely different kinds of competitors who are intent on disrupting our historical approach, and oftentimes for good reason. We do great things at MedStar. We do great things in the U.S. healthcare system. I'm proud of MedStar, proud to be part of the U.S. healthcare system. I think it's the finest healthcare system in the world. And that being said, we're not really great. See, we do great things on a Tuesday or a Thursday. We do great things for some patients, but we don't do great things every day. We don't do great things for every patient. Right? We have variability. And if you have variability, then you haven't hardwired in greatness. And it means that for an individual patient, maybe they come to us and they get us on a great day. Maybe they get us on a good day or an average day. My parents utilize our healthcare system, it seems like every week right now. I'd like to know that they're going to get us on a great day. So you can't argue when others say we can use technology and information to think differently, to hardwire greatness, to make sure that systemically we provide all the best outcome based on evidence-based medicine. We also know that costs aren't sustainable in the country. Now, that's not all our fault at all. But I would contend and challenge you to say, who better than all of us, our physicians, nurses, therapists, those that are inside organizations like MedStar Health, who better to actually think about how to bring best practice in a cost-effective way to the communities we serve. I do not want to leave that job to the smart people at Apple or those running Walmart. Our mission's deeper, our organizational memory about what's important, even as we change, too important. So as I think about organizational memory, it's critical as we go forward, but it also, in my opinion, it's both a positive and a negative force as we think differently about the future. It's important to remember, to have organizational memory about what matters, right? Every slide you ever see from me or anybody else, bring it back to one patient at a time. There is a patient and a family that are in our touch, that are in our organization somehow at their moment of need. That always keeps us grounded and should always remind us, as we're building out and thinking differently, what matters. We need to remember from an organizational memory standpoint the mistakes we've made because we do not have enough time to make them again. We have to remember that we're not alone as individuals or organizations within MedStar, and we're not at the start of this journey. And that lets me bring systemness into this conversation. You didn't think you were going to get a presentation from me and not hear my favorite word, right? The strength in systemness, in our ability to share knowledge, to go back and pull from our organizational memory or to take new advances and bring them together, critically important. And we have to have organizational memory about our successes because we should find courage in all of the great work that you've done to date. We've got so many cutting-edge examples of important work we're doing. We are leading the nation, leading our region, providing for our communities in so many ways that are wonderful. Let's remember, if we just went back 5 and 10 years ago, and I've done this with the leadership team, if I look back 10 years ago and 5 years ago, we put a list of things on a board and said, boy, if we could just do that 5 years from now, that'd be a pretty good 5 years. We blew all that away. And that's my appreciation and thanks to all of you for your leadership and those, again, who work with you. And that being said, it never stops, right? Because healthcare is changing in such significant ways. So we have to use those past successes. But I would also contend and suggest to you that organizational memory is also absolutely one of my biggest concerns for us as an organization. Because memory of the past and our view of how special the past is really does have the opportunity to stifle change and to get in the way of creativity and to cause us not to think that we should think differently. And as with many of our recollections, the good old days perhaps were just not that good. And at best, I would say to you, the good old days won't be good enough tomorrow. So with all that said, you can see the connection of how organizational memory comes in lots of different ways. Let me give you just a little another perspective on thinking differently, because again, it wouldn't be a presentation from me. I'll take some help just getting to the second slide in that. It wouldn't be a presentation from me if we didn't talk, and you all can look at this. Some of you in the room were absolutely a part of actually creating this. This is just a construct done in 2010 by a group of MedStar associates from all levels of the organization in a variety of functional areas. We brought them together as part of a strategic planning exercise to look out to MedStar to 2020. This is 2010. So we're taking a 10-year outlook. We're telling them to think differently, no constraints. How will healthcare get provided? What are the kinds of issues we should be thinking about? And we're going to use this then to drive what became MedStar 2020. And if you look from the left going to the right, you'll see, I won't point out for time, but you can spend time with this slide. You'll see certain aspects of how care is going to get provided that really have been spot on. Personalized medicine, the movement to post-acute, where's all the primary care docs, partnerships, again, they're thinking totally differently. And then all the way to the top right, they were very comforting. They gave me a slide that said trouble ahead. And guess what? They were right. And then it said underneath there that, again, the present system is not sustainable. So think about that. It's a pretty powerful line, right? Because if you know something's not sustainable and you have organizational memory about why it's so important for us to protect that most special of parts of our mission, then you would think we'd have full energy about thinking differently, acting differently, and building a healthcare system for the future. But it's not that easy sometimes to get out of what we respect about the past, and change is hard. But again, this gave us the basis to then move through a host of issues, and you can see as you look down on the right, combining research and IT, information with innovation to drive change. There's real power that's inside of this slide. All of this came about then and drove what became MedStar 2020 and a true distributed delivery network. I would say to you that if you look backwards at the time that this work was being done, the healthcare system in America, and true for MedStar, was really a hospital-centric healthcare system, In the future, and today as well, hospitals are absolutely critically important for the U.S. healthcare system. They're a critical component of MedStar Health. That'll never change. I think the change, the thinking differently, is around centric. Is our focus about healthcare historically so lasered in through one main play, and it all came inside the four walls of a major big facility, a big box healthcare provider, a hospital. The future's really about a connected care continuum. And if you think about that chart and the variety of different aspects, that's really what's playing out. And in our strategic presentation, that connected continuum actually became words that I used as a distributed care delivery network. Distributed care, right? Care has to be distributed. You have to think about how we bring care to where people live. Access, convenience mattered, cost mattered. It couldn't be all roads leading into the urban core. Even traffic patterns around Baltimore and Washington wouldn't support that any longer. Technology, where care could be provided, all changing. But it wasn't going to be good enough if it was just distributed, because we have to think through the eyes of a patient. So if there's 200 doors into MedStar and they feel like 200 disconnected doors, there's not a whole lot of value in that equation if you're a patient. So it had to be a care delivery network. Information has to be ubiquitous, the same service and quality standards. The ability to connect in any one of those doors and get to our most significant specialist in a connected, seamless way. That's the vision of MedStar 2020. And what's interesting, as time goes by, we have the MedStar annual board retreat later this week. We'll actually have folks from MI2, I'm proud to say, as part of one of those presentations, because the board's retreat this week is around strategy and structure being informed by information, innovation, and research. Because we're now starting probably a couple of year segue into MedStar 2025, if you can believe how fast the years go by. So let me just finish with one last slide, if I can just get that changed. There's a quote, actually, from John Cage that I'd like you to consider. I can't understand why people are frightened by new ideas. I'm frightened by the old ones. Reflect on that a little bit. I think it's very, very connected to organizational memory, but also the need and sometimes the inability to go forward and to think differently. I saw that quote on a tour down at 1776, DC incubator, a lot of excitement. MI2, one of the founding partners, I'm on a tour there with Mark. I see it on the wall. It stops me. Powerful quote to me. John Cage was a 20th century American composer. In 1952, he wrote a disruptive composition called 4 minutes and 33 seconds. It's performed in the absence of any deliberate sound from musicians. Any deliberate sound from musicians. They sit there, and it's just the surrounding environmental sounds, the ambient noises, depending on where they're sitting. To let you know how thinking differently can get so powerful, there's actually an app you could go to today. There are Cage disruptive 4 minute, 33 second compositions that happen all across the globe. And they're totally different. And they're different because of where they actually take place. If you think about thinking differently, for clearly you're a president who grew up in a box structured, that's pretty thinking differently. But really it makes the point. So I just end by saying to all of you, I need you to think differently. I need you to keep your organizational memory about what's important, but you have to help lead, because the future, in terms of our ability to truly meet the needs of our communities, it's not going to be in how we delivered great care in the past. And I would say to all of you and challenge you that who better to protect what's special in your organizational memory, and yet to find a way that we can embrace change for a new day. I'm excited for you all today. I hope you have a great day. I'm glad I got to spend a little bit of time with you. And Mrs. Story, great job. Thank you all.
That's great.